Alberta's response has been effective through most of the past 9 months. We actually led large jurisdictions in Canada with, I should say, we had the lowest rates of transmission of the large population jurisdictions in Canada, lower than all 50 United States and lower than almost all European countries in terms of active cases, hospitalizations, ICU admissions, and COVID-related fatalities. Obviously, in the past few weeks, we've seen a significant increase in the new case count. And what we've also done, though, through all of this is led in our response. We were the best prepared, I believe, in North America with respect to personal protective equipment. We have led in terms of testing. We've had the most robust contact tracing system. Obviously, it's now compromised because of the significant spike in cases, but through 8 of the past 9 months, we've, I believe, had the strongest contact tracing. We were the first to develop a wireless app connected into contact tracing to support it, the first to develop a online assessment tool. So I think, and we had much lower levels of fatalities in nursing homes and long-term care facilities amongst the large population provinces. So all of those facts are to the credit of Albertans for the responsibility that they've demonstrated. Obviously, like we see all across the Western world, and as was predictable in the fall, as the weather turns and people move indoors, there is a significant spike in cases, and that's what we're addressing here today. And we've always said that we would address this as the situation unfolded. You ask, why aren't we taking even more stringent measures? The answer is we are trying to bend down the curve. Alberta is not involved in a chase after zero because, in our view, the broader consequences for the health of our society would be intolerable. To try to get to zero with a widespread shutdown. I point to jurisdictions that promise circuit breakers for 2 weeks that 3 and 4 months later are still in unprecedented and extraordinary shutdowns of broader social and economic activity with massive impacts on the health of those societies, on mental and emotional health, on physical health, on people's ability to earn a living, and on so much more. Not to mention, by the way, in so much of the debate, where have we forgotten about the Charter of Rights and Freedoms? Since when should governments start with an impairment of fundamental charter-protected rights and freedoms rather than engage in such an impairment as a last and final resort? The charter jurisprudence is very clear about this, that if governments are to impair charter rights, it must be a minimal impairment to achieve a policy goal. So that too has informed our approach.